Westmoreland Community Connections is a presentation of the Westmoreland Drug and Alcohol Commission.
Welcome to Westmoreland Community Connections, a look at issues and happenings on Classic Hits 107.1 WHJB. Here now is your host, Chad Ammond, President and CEO of the Westmoreland County Chamber of Commerce.
Hello and welcome to Westmoreland Community Connections. I'm your host, President of the Westmoreland County Chamber of Commerce, Chad Ammond. We're going to talk today about some things that everybody needs to do, and that is breathe. We are pleased to have with us Jessica Schuman. Jessica is an RN and a certified asthma educator from Breathe, Pennsylvania. And we also have with us the Executive Director of Breathe, Pennsylvania, Carla Conrad. Ladies, thanks for being with us.
Thanks for having us.
So tell me a little bit about what is Breathe, Pennsylvania?
Breathe, Pennsylvania is a not-for-profit organization. We were founded in 1904, and we're based in Cranberry Township in Butler County. We serve 10 counties in southwestern Pennsylvania, and we serve them by providing education and direct services to people with lung disease. So if you have a disease like COPD, asthma, any kind of pulmonary fibrosis, cystic fibrosis, we can help through education.
So give us a little bit of background. How did Breathe, Pennsylvania get started? I mean, you mentioned that it started in 1904. That's a long time.
Right. So in 1904, a group of industrialists got together and they recognized that tuberculosis at the time was really harming Western Pennsylvanians, and they wanted to do something about it. So in 1906, we became a formal organization, and when that happened, there were enough funds raised where a property was purchased in the Hill District and an open-air hospital was built. At the time, tuberculosis was treated by treating people, leaving them outside in fresh air and allowing them to get enough rest. So the hospital that was built in the Hill District had these open porches with beds on them, and people would sit outside no matter what time of year and be treated with rest and fresh air.
It really doesn't sound like the worst thing in the world, but I guess that probably didn't necessarily treat tuberculosis.
Right. So it helped people that could essentially have their immune systems kick in, kind of treat the TB, or at least let it go into a latent state where it wasn't an active disease. But those patients that had active disease did get worse and would perish because of it. Nowadays, we don't treat tuberculosis the same way. You have a really regimented dose of treatment like rifampin and INH, where you're on medications for about 6 to 9 months.
Carla, we were talking before the broadcast about how hospitals in southwestern Pennsylvania were designed to treat tuberculosis. It was must obviously have been a rampant disease
right.
in the early 1900s.
Right. So tuberculosis is spread through droplets in the air. So if I sing or I cough or I'm talking near you and I have these water droplets that come out of my mouth, you could easily inhale them. And if you have any kind of immune suppression, it gets into your lungs and it starts to grow. The hospitals at the time, when they were built, they were just kind of freestanding hospitals. And as tuberculosis became more and more of an issue, these hospitals didn't want to put people with an airborne disease like tuberculosis next to somebody that had maybe, a surgery of some sort. So they would build these wings. And West Penn Hospital is a good example where it's almost built like a big X to keep the tuberculosis patients down one wing, where they could keep patients with different kind of illnesses down other wings to prevent cross-contamination.
That's funny that you mentioned that, because I had heard a long time ago that hospitals were also designed because of the steel industry, because of burns. Burns were so rampant as well that
right.
southwestern Pennsylvania has a strong history in burn relief.
That's exactly right. And if you think about it, we have to try to isolate those types of infections, because somebody that's got burns all over their body is really susceptible to getting sick, more so than somebody who just has a head cold and they might need some simple antibiotics.
You're listening to Westmoreland Community Connections on WHJB 107.1. We are talking with two ladies from Breathe, Pennsylvania, Carla Conrad, the Executive Director, and Jessica Schuman, Certified Asthma Educator. Jessica, I'm going to ask you, why is educating people about lung disease so important, and how do you do that?
I think that when we're educating, we are unfortunately poor perceivers of our medical conditions and our symptoms. So I think it's really important to give people a little handle on it. They need education. We lack in education a lot. I specifically work with children and all of the people who work with that child with asthma. But we find that in our program, if we bring it down to the children's level, they start to identify quicker and they get themselves to a nurse or a school nurse quicker, and it keeps them in school. So that's why I think it's really important. Everybody's capable of being educated. There's no age limit on that.
You mentioned asthma, and is that the specific disease that you focus on, or are there other lung diseases that you tend to focus on?
Yeah, so we focus on every lung disease, but the vast majority of our programming is centered around patients with COPD, which is emphysema, chronic bronchitis, and then sometimes asthma is lumped into that COPD kind of classification. COPD stands for chronic obstructive pulmonary disease. So if you have a disease like emphysema or chronic bronchitis, it's not reversible. You have that disease and you have to learn to manage that disease and treat it. It's not going to necessarily heal or go away. With asthma, you have asthma, but you have asthma attacks. So you're not necessarily in disease all the time. You have to treat the asthma attack, and then you can go back to living your normal life for most people. A lot of times there's allergic components that cross over, but we teach people how to do that. The other issues that we deal with and educate people about are issues like sleep apnea. So you don't think of sleep apnea being
that's a
something,
breathing disease?
Yeah. So when you're sleeping, you have a lot of soft tissue in your neck and in the back of your tongue. And during sleep, a lot of times that soft tissue, it becomes softer when you fall asleep. It can slide down the back of the throat and actually block the airway. And so you stop breathing through the course of the night. We call that obstructive sleep apnea. And so your body senses that you need to breathe. Your chest wall will make movements, and your brain is firing these signals to say, okay, you need to breathe, take a breath, take a breath. But with that occlusion or that blockage in your airway, your body can't get any air. So you wake up kind of snorting and gasping, and you feel tired, and it really causes other issues when it goes untreated. So if you have obstructive sleep apnea and you don't treat it, you have a higher likelihood of developing diseases like hypertension, having a disease like a stroke, having any kind of condition along those lines.
So does Breathe Pennsylvania, because you're talking about sleep apnea, and I'm completely naive to some of this stuff. So I always picture sleep apnea to be something that affects people that are a little bit older, right?
Yeah.
I mean, maybe adults,
right?
But then asthma, I always think of asthma as something that is sort of found with kids. So are you reaching out to people of all ages?
We do, right. So sleep apnea actually affects anybody at any age. We find that a lot of people who are diagnosed with asthma are diagnosed early in life, but a lot of times those asthma symptoms continue to plague them as they get into adulthood. And so it's not necessarily something that goes away. People that have COPD, that tends to affect them when they're older. So we see people that are generally in their 50s and up. And so really these diseases can run the gamut in terms of age.
When I was looking at Breathe Pennsylvania, I think one of the words was that you empower people that have individuals with lung disease. How exactly do you do that?
Well, one of the ways that we empower our adult education participants is that we correspond with them and talk to them about what questions they should be asking their doctor. We want to teach them what their disease is, how to live with their disease and manage their disease to stay out of the hospital. A lot of patients who are taking respiratory medications, it's not as simple as just swallowing a pill. So I can't just hand something to you and say, okay, I want you to take this medication and be on your way. You have to have this technique where you're breathing and holding your breath and inhaling medication all at the same time. And if you don't do it well, you're going to just give yourself medication all through your mouth and you're going to swallow it into your stomach and it won't work. So we try to empower people by teaching them how to take their medications and why it's important to do so, but then also to get them to follow up with their physicians and address any kind of questions that they can think of so that they can stay home and healthy.
We are talking with two ladies from Breathe, Pennsylvania, Carla Conrad, the executive director, and Jessica Schuman, a certified asthma educator and nurse. Ladies, we're getting to that point in the year where it's going to start to get cold. And I know that when I go out and shovel the driveway, when I come in, I feel like I have a hard time breathing, and I don't think I have any breathing or lung disorders, but I can imagine that when somebody has a breathing disorder, when they're out in the winter months, and then there's pneumonia out there, and there's the flu out there, this has to be probably a time where somebody that has lung disorders is probably has a little bit of apprehension going into the winter months. Is that correct?
Absolutely. So we try to talk to people about what they can do to prevent kind of their breathing from getting worse as they head into the winter season. One of the things that we really encourage people to do is to cover up their mouth and their nose whenever they go outside. So we offer cold weather masks that are free to Westmoreland County residents. And all you have to do is call our office or go to our website and get our contact information. And it's a foam mask that covers your mouth and your nose. And what it does is it captures that moisture that you exhale so that when you inhale the next time, you're not inhaling really cold, dry air.
And it's a weather mask.
Correct.
What does it look like? Does it look like one of those?
It's like a thin black kind of foam.
Okay.
So it's maybe about a 1/4 inch diameter thickness, and it has little tabs that go around your ears. So it's not the prettiest thing to look at, but if it keeps you so that you can go outside and you can stay outside without getting winded or short of breath, then it's definitely worth it. For those people that are kind of concerned about how that looks, they can always put a scarf over top of it as well.
And how would a listener get that?
So you could go to our website. Our website is www.breathepa.org. So that's BREATHEPA.org. Or you can call our office directly, and that office number is 724-772-1750.
So that's a breathe mask. But what other things will impact residents in southwestern Pennsylvania as winter hits?
So one of the things we really encourage people to do is talk to their physician about getting a flu shot, talk to their physician about getting a pneumonia shot. And I'm going to have Jessica talk a little bit about that and why those two things are so important.
All right, Jessica, you're up.
Well, just a quick little bit of info about pneumonia and what the flu are. Pneumonia is usually bacterial or viral in nature. You can get it from funguses or parasite, but that's very rare. So commonly we see younger children, babies, toddlers, and then older adults who are very prone to pneumonia. But also, everybody's really prone to pneumonia. Pneumonia is kind of like a silent, I hate to call it a silent killer, but it can be because we have people walking around with it who don't know they have it.
Well, that's one of the things I hear all the time, walking pneumonia. What's the difference between pneumonia and walking pneumonia? Is it just that you don't really know you have it? And
I think a lot of people, they don't think they have it. They are maybe stressed, fatigued, having trouble breathing, but they're kind of attributing it to other things in their lives. It's usually young people, working individuals who are out and about. I had a boss once who excessively got it because he overworked himself. So he just thought he was overworked or tired and not ever really looking. Remember, I said we were poor perceivers.
Right,
So
that's right.
we have the tendency to overlook things or just don't have time for those things. But pneumonia is basically just like Carla was saying about tuberculosis. It's a germ that we breathe in, and we sometimes will see it after the flu or bronchitis because our bodies are weakened. So it settles into the lungs and kind of starts to infiltrate in there and grow. You're going to see a lot of coughing with green type of spit up. You're going to have trouble breathing. Be very fatigued, very tired. So we have our stress in our lives, so we sometimes think that's what it is, but really we need to pay attention to, when that stress or your fatigue is really at a high level, that you get checked out.
You're listening to Westmoreland Community Connections on 107.1 WHJB. We'll be right back after these messages. When we return, we're going to talk a little bit more about Breathe Pennsylvania and how you can get involved with the organization. We'll be right back after these messages.
This is Westmoreland Community Connections on Classic Hits 107.1 WHJB. If you have a suggestion for a topic, or if your nonprofit organization would like to be featured on this program, call us during regular business hours at 724-216-1200.
Westmoreland Community Connections is a presentation of the Westmoreland Drug and Alcohol Commission.
Welcome back. You're listening to Westmoreland Community Connections on Classic Hits 107.1 WHJB and on the web at WHJBFM.com. I'm your host, Chad Ammon, president of the Westmoreland County Chamber of Commerce. Our guests today are Carla Conrad, the executive director of Breathe Pennsylvania, and Jessica Schuman, who is a certified asthma educator and an RN. Ladies, before we went to the break in the action, we were talking about pneumonia, we were talking about tuberculosis. It were some conversations that probably had the listener saying, "Oh my goodness, what's going on here in southwestern Pennsylvania?" But you're here to help with Breathe Pennsylvania. It's an organization that is, I guess, geared towards educating and helping people with lung disorders. And one of those is influenza. Before we get into all about Breathe Pennsylvania, let's talk a little bit about influenza because that flu season is going to be coming here. How does it occur? Why is it so serious for the lungs?
The flu is how we all know it is caused by the influenza virus. Something that people automatically think when they have the flu is that it is a bacterial infection and we treat it with antibiotics. This is not true with the flu. This is a virus that's going to can affect anybody of any age. Now, younger children, toddlers, babies, pregnant moms, and older adults are much more prone to it because of their immune systems. Also, anybody who would be immunodeficient. But it's really important for all people to keep themselves healthy when it comes to the flu. The flu, again, is just a virus that's going to attack the body and it's going to settle. You're going to feel pain and tired, just be all around sick, nausea, vomiting, sinus issues. But with the flu, it can be very mild to even death. So it's very important that you identify if you have the flu. And if you've ever had it, you know you have it usually. You can get the flu vaccine. It is very important to get that, or even with pneumonia, the pneumonia vaccine. But there's also other lines of defense. Number one, wash your hands. I know it seems so funny and so common, but I know we've all been there and we've seen people not do it. So that's really important is wash your hands. Get the bacteria and the viruses off your hands. And holiday seasons are coming up, and if any one of your families are like mine, they love to kiss you, and they joke with me because I always put my hand up and say, "It's cold and flu season. Please don't kiss me," because that is how you spread germs too. So, rest. If you're stressed out, make sure you're getting enough rest and a lot of hydration. You want to stay more with electrolytes or water. And even if you get the flu, that's important too, to hydrate yourself and stay away from things like, as we call them, Pittsburgh pop, because it is found that it's a little dehydrating to the body. So water and proper hydration and just take care of yourself.
So we've talked flu, we've talked pneumonia, we've talked COPD, we've talked asthma. There's no doubt that there is definitely a need for Breathe Pennsylvania. But let's talk a little bit for the listeners that is listening out there that has a chronic lung disease or is maybe caring for a loved one with a chronic lung disease. Why should they get involved with Breathe Pennsylvania? Why don't we just let you do what you do and let the listeners and the residents that have lung disease just go along with what they have? Why do they need to be involved?
Well, our mission is to help Western Pennsylvanians breathe better and live healthier. And I'll tell you, Chad, that a lot of the time what we find is that it's caregiver or a parent or a child that calls our office and says, I need help. I don't really know what else to do. Maybe their child is struggling at school and they're skipping out at recess, and the school thinks that they're just trying to get out of something. When the parent says there's really an issue here, we can be that advocate for that family. With adults, sometimes we find that people, especially people of a certain age, they don't want to question their physician. They don't feel comfortable asking questions. And so they feel it's disrespectful. And we can teach them how to go about kind of addressing those needs that they have and empowering them by doing that so that they can keep themselves healthy. We are a unique organization because we're not like many nonprofits where you can call us up and you can reach a respiratory therapist or a nurse or an addiction specialist or a social worker right when you call. Somebody answers the phone and you can talk to an expert that same day. So that makes us unique. The other thing that makes us a little bit unique is we go out into your community. So you don't have to come to us in order to get the education. We don't want anybody to feel so burdened that they can't get to Cranberry Township. We know that people can't get to Cranberry.
Yeah, you said you're based in Cranberry Township, but you do work in Westmoreland County. Well, I gathered that you do work all around the region, correct?
That's correct.
You just happen to have an office in Cranberry.
Right. That's where we're sort of, our home base is. But we go everywhere in that 10-county region and sometimes outside of that 10-county region, depending on the need.
Since this is Westmoreland Community Connections, what sort of work are you doing in Westmoreland County?
Well, what we do primarily is our school programs. So we help children and their caregivers, but also we help school nurses and school personnel to try to identify the signs and symptoms of asthma before an asthma attack occurs. So that's one of the things we do. Another thing that we do is we help serve a need. So a lot of people don't realize that possessing tobacco products on school property is an offense that will send you to the magistrate. Oh. And so a lot of the magistrates in Westmoreland County have identified us as an alternative to a fine. So they can send the child to us for an intensive tobacco cessation education, and then in lieu of the fine, they get the education.
I see. So do you do tobacco cessation? I mean, obviously, I guess obviously, smoking has to be something that contributes to lung disease, right? I mean,
Absolutely.
I think everybody knows that. So do you do smoking cessation programs? Because we talked about all of the diseases and things like that, but do you do programs to maybe stop the problem before it occurs?
That's correct. So we in the past have worked with Penn State Extension, which is located right in Greensburg. Right. And we've also worked with St. Vincent Prevention Project. So they usually call us when there's a need. We do education with them, and you'll find us in our community doing those classes. It really depends on what the community is saying that they have a need for, and then we kind of adjust what programming we're doing to address that need.
Well, Carla, do you have any examples of the impact that the programs are having in the region, not just here in Westmoreland County, but all across the region? Are there some examples that you can share with the listeners that say, hey, here's what Breathe Pennsylvania is doing, here's what we are doing to impact the community and help to make people that are having breathing disorders to breathe better?
Sure. I think one of the best examples is our direct lung education program. So during that program, we would have one of our staff respiratory therapists sit down with a patient, either one-on-one or in a small group, and do a complete education session about what their lung disease is, how it needs to be managed, what types of medications they might be on. We can teach them how to use a spacer, which is essentially an extension tubing so that you're not getting all the medication in the back of your throat whenever you use your inhaler or your puffer. And when we do that education, we're finding that more than 90% of the people after the education learn something new from that one-on-one session.
Oh, wow.
Which is huge. You assume people kind of know what they're doing when they leave the doctor's office or when they leave the pharmacy. The fact of the matter is that when you sit down with somebody and you spend time talking with them about their lung disease, they are more comfortable asking questions, and you can sort of fill in those gaps as a practitioner. The other thing that we found with that program is that more than half of the people that we've educated follow up with their doctor about something that they learned. So maybe it's somebody who's thinking, boy, I might try pulmonary rehab now. Pulmonary rehab is essentially where somebody with lung disease goes to a gym and they work out on a treadmill and they work out on a bike and they do weights, but they do it under the purview or while a respiratory therapist or a nurse is watching them, making sure that they don't get too short of breath. And so we have patients go back to their doctor's office and they say to their doctor, I heard about pulmonary rehab. Can you tell me where I can find more information, or can you write me a prescription so I can go and have it covered by insurance?
So I guess one of the things that I'm hearing from you is that even if you're going to your doctor and the doctor is diagnosing you with exactly what you have, you may still not be implementing or taking the medication in the correct way. And that's one of the things that Breathe Pennsylvania can help listeners and patients with.
That's absolutely right. Even if you have the best doctor, you're still going to walk away sometimes with some questions. You ever get home and think, boy, I should have asked them that, or, oh, I didn't think of that at the time. That's where Breathe Pennsylvania comes in. And all you have to do is give us a call.
We mentioned, I don't want to go back too far, but you mentioned about the smoking cessation too. The smoking cessation programs for the listeners that are maybe company owners or HR directors or something like that, is that something that they can connect with Breathe Pennsylvania and you'll come out and, walk their workforce through a smoking cessation program? Because obviously one of the things, with my role at the chamber, we know that one of the things that is the biggest expense is healthcare. And if you can eliminate the smoking, you've eliminated something that's going to cost you money. I mean, I don't want to be it's all dollars and cents, but I know that it's an important
that's absolutely
piece
right. And it's not
employers.
only a problem for the employers, but the employees over the long term spend a lot more money taking care of themselves. That's absolutely something we do. And we can do it one of two ways. So the first way is you can have us out to your organization. We can do an education with your employees. The second way, some organizations find to be helpful, is that they identify someone internally who can spend time and sit down, and we train them in the methods of tobacco cessation. And then they are like the lifeline for the organization. They just call us if they need additional supports.
Since we were talking about dollars, Breathe Pennsylvania is an